It's like a wickedly common story that you hear people getting off birth control and their mental health improves significantly.
There are millions of people all around the world who use contraceptives, but for years now, there have been questions on whether or not there's a link between hormonal birth control pills and depression and anxiety. Stories have been flooding social media, questioning if contraceptives can have an impact on mental health. Emily Thomas, who has over 150,000 TikTok followers, is one of many who decided to share her experiences.
I've been on my second IUD for just over a year now, and it's been about 8 months that I've been experiencing like borderline debilitating anxiety. And I started thinking maybe there could be a tie.
Emily says she's considering making changes after hearing many stories of people who were on birth control.
They finally looked into it, got off of it, and their mood improved significantly. Their depression essentially went away, their anxiety symptoms decreased.
A contraceptive expert who's also an OBGYN says healthcare providers need to take concerns seriously and provide more context to patients. But when it comes to the research on birth control and depression, she says the scientific literature doesn't answer that question well.
The state of the evidence around that is pretty poor. And what I mean by that is that there aren't a lot of really well-designed studies that have actually looked at that issue and really come to any kind of convincing conclusions.
Health Canada tells CityNews it has funded some research, adding that Canadian labeling of hormonal birth control products include a warning about the risk of depression and mood changes, stating it's continuing to monitor safety information and potential risks.
It would be really nice to see this looked into further, because it's really just girls having to play off of each other's experiences.
In the U.S., psychologist Sarah E. Hill penned a book on the psychological effects of hormonal contraceptives and the association with depression.
Understanding that hormonal birth control can influence the brain doesn't necessarily mean that we need to completely abandon hormonal birth control, because the fact of the matter is women don't have a lot of really safe, easy to use, effective options.
In 2007, an Australian researcher published a pilot study noting a link between depression and the contraceptive pill.
We did a prospective study where we followed up women who were taking the pill for 3 months, 3 cycles. And what we found was that, in fact, women who were taking the pill were more likely to have depression and anxiety as part of that depressive disorder. Some pills were worse than others.
Professor Kulkarni says that was 15 years ago and more research is needed, including during clinical trials.
It's not seen as a priority area. Women's mental health nationally as well as internationally has not received the attention it should, and this is an example.
Dr. Waddington says it's vital, though, to recognize that many people need and rely on birth control.
I see a lot of patients who start on contraceptive methods, and I would say that the majority of people, like this method. I have seen people come back with concerns about this or that side effect, and here's what we've done about that.
Dr. Waddington says it's important that patients feel empowered to ask questions and address concerns with their primary healthcare provider and find an option that best works for them. In Toronto, I'm Faiza Amin for City News.